Mr. Speaker, one of the issues raised this morning at the Phoenix Sinclair inquiry is the fact that it took months and months to get a psychiatric assessment for Phoenix's mother, Samantha Kimach, when her flat emotional affect towards Phoenix was noted shortly after birth. Linda Burnside's 2012 report to the Children's Advocate notes, and I quote, "The scarcity of mental health supports, outreach or treatment facilities, and the limited availability of mental health resources in Manitoba are part of the problem." She also highlights the barriers to accessing mental health services. I ask the Premier, when will he start investing in programs that are effective and reduce barriers to access instead of spending money in ways that aren't working?
Thank you, Mr. Speaker. Several resources have been dedicated to dealing with mental health issues, both at the community level with programs like PACT, with additional resources and expansion of services available at Selkirk, with a new mental health court, first time ever delivered in the province of Manitoba. It's going very well. They work in partnership with members of the healthcare system, the WRIJ, to make sure appropriate assessments are done and treatment and appropriate sentencing occurs. We opened the new crisis prevention unit, first ever in Canada, system of emergency room treatment where people can come and get help with a social worker, or get help with a psychologist or a nurse practitioner or somebody specific to their needs. There's a team approach going on there. It's widely admired across the country. We know that these issues are very significant and they need attention, and that's why we put resources to them, and we will continue to find innovative ways to do that, Mr. Speaker.
Mr. Speaker, the problem is it's not really happening. 2 weeks ago, I brought up the problem that too many youth who have been abused when they were in care or before they were in care are not receiving the psychological help and counseling they need, and as a result, their own lives deteriorated to the point where they have difficulties as adolescents and adults. Now, Linda Burnside comments that governments need to realize that the costs they prioritize are exacerbated by the needs of people who were traumatized in childhood, did not have their traumas addressed, and became struggling adults. I ask the Premier, when will those who need the mental health services, and particularly those with child and family services issues, actually be able to get the service they need in a timely fashion?
The question is important. We have, for example, tripled the funding we provide to nonprofit mental health organizations. As I've indicated, we've opened up the crisis prevention unit. We are doing things on the prevention side in the public schools. We have an exercise called PACTS, which teaches mental health and resiliency skills to young people from an early age, including conflict resolution. We have the Kennedy hockey player approach program that we do in the schools, teaching respect among young people and differences. And some of the biggest causes of mental health concerns are how people are treated in the schools. We have Bill 18, which has been on the books for 8 months. We only ask that the members of the opposition give all those people in the public that want to improve safety in schools, respect diversity, and improve mental health have a chance to be heard. And let's debate the bill and make Manitoba an even better place to live.
Mr. Speaker, the issue of children in child and family services care is a pretty important one. Phoenix Sinclair's biological father, Steve Sinclair, said he wasn't ready to be a parent, presumably in part because he had had a negative experience in child and family services and he hadn't received adequate training in parenting as part of the counseling and support he should have received while he was in CFS care. These children, like Steve in CFS care, for whom the government is the guardian or effective parent, these children are wards of the state. And I ask the Premier, why is it that these children are receiving so little support in timely mental health services and guidance in learning how to parent when their need is so great?
Again, Mr. Speaker, it's a good question. We did have an issue at one point where young people reaching the age of 18 left the child welfare system with no follow-up supports. And there have been programs put in place to help people bridge into young adulthood, which is a very important part of life. They can get mental health support. CMHA is involved in the project. They can get financial counseling support. Community Financial Counseling Services is involved in the project. They can get a variety of services from around the city. And if they have take on the responsibility of becoming a new parent, there are specific resources available to people that are young parents that used to be members of the child welfare system. So very specific resources have been identified for people that are in those kinds of circumstances, Mr. Speaker.